Hello, I'm going to take you through antiarrhythmic agents. So I'm going to help you understand medications to manage cardiac dysrhythmias. Antiarrhythmic agents are also known as cardiac dysrhythmia medications, and they are a group of pharmaceuticals that are used to suppress abnormally fast rhythms such as atrial fibrillation, supraventricular tachycardia, and ventricular tachycardia. The main types of antiarrhythmic agents are the beta blockers, Lidocaine, also known as Lidocaine, and Quinidine. Beta blockers such as Atenolol block beta adrenergic receptors in the heart and thereby decrease heart rate and myocardial contractility and oxygen consumption, particularly during exercise. Beta blockers are first-line therapy for patients with effort-induced chronic stable angina. They improve exercise tolerance, relieve symptoms, reduce the severity and frequency of angina attacks, and increase the angina threshold. You should withdraw beta blockers gradually to avoid precipitating an angina attack. They should also not be used in patients with coronary vasospasms, such as Prinzmetal angina. Beta blockers may precipitate asthma, and you should not use them in patients with asthma or a history of obstructive airways disease. Some, including Atenolol, have less effect on the beta 2, which are the bronchial receptors, and are therefore relatively cardioselective. Although they have less effect on airways resistance, they are not free of this effect and should be avoided. You should use beta blockers with caution in diabetes since they mask the symptoms of hypoglycemia such as rapid heart rate. Beta blockers enhance the hypoglycemic effect of insulin and may precipitate hypoglycemia. In this case, before administering the drugs, get the proper medical history of the patient. So the effects of beta blockers is mostly to decrease the following: 1. Contractility, 2. Relaxation heart, 3. Heart rate, and 4. The conduction velocity. When nursing patients on beta blockers, you should monitor and advise them as follows. Advise them to avoid the abrupt withdrawal of the therapy because it puts them at risk of rebound tachycardia and hypertension. Beta blockers can cause transient increases in serum lipid and glucose levels. Monitor diabetic patients who are on insulin for symptoms of hypoglycemia. Monitor patients on other beta blockers such as Propranolol for bronchoconstriction and asthma symptoms. One of the examples of beta blockers is Atenolol, also known as tenomine. Atenolol is a representative beta adrenoceptor antagonist. It comes as a tablet of 50 mg, 100 mg, and as well as a solution for injection of 50 micrograms per ml, and as an ampule for over 10 ml. Atenolol is used to treat angina and myocardial infarction, arrhythmias, and it is also used as a prophylaxis for hypertension migraine. When it comes to the dosage, for angina by mouth in adults, 50 mg once daily is given, and then it is increased if necessary to 50 mg twice daily or 100 mg once daily. Then if you are treating for myocardial infarction, early intervention is done within 12 hours. So by intravenous injection, it is given over 5 minutes, and then 5 mg is given. Thereby 50 mg by mouth after 15 minutes, followed by 50 mg after 12 hours, and then 100 mg once daily. Then the side effects of Atenolol includes bradycardia, heart failure, conduction disorders, bronchospasms, peripheral vasoconstrictions, GIT disturbances, sleep disorders, as well as fatigue. So this drug is contraindicated in asthma, as well as in uncontrolled heart failure, in pleuritic angina, and marked bradycardia. Not only that, it is also contraindicated in hypotension and many others like metabolic acidosis and so on. Okay, another example of beta blockers is propranolol, also known as Inderol. So this propranolol is competitively blocks stimulation of B adrenergic receptors within vascular smooth muscles and produces chronotropic inotropic activity. It slows conduction of atrioventricular node and decreases the heart rate, which decreases the oxygen consumption in myocardium, suppressing the renin, aldosterone, angiotensin system at high doses, and also inhibits the B receptors in the bronchial system. So this propranolol, it comes as a tablet containing 10 mg, 40 mg, and 80 mg. It also comes as a solution containing 5 mg per 5 ml and 50 mg per 5 ml, as well as an injection containing 1 mg per ml. It is indicated in hypertension as well as in arrhythmias. Propranolol, if you're giving it in arrhythmias, you give 10 to 40 mg daily. So apart from the beta blockers, other antiarrhythmic agents include Lidocaine and Quinidine. So Lidocaine, also known as Lidocaine, it increases the electrical stimulation threshold of ventricle and the Purkinje system, which stabilizes the cardiac membrane and decreases atomicity. This Lidocaine, it comes as a glucose intravenous infusion with 0.1% containing 1 mg per ml, 0.2% containing 2 mg per ml, and 5% containing 50 mg per ml. It also comes as an injection containing 1% of 10 mg per ml and 2% of 20 mg per ml. It is indicated in arrhythmias. So the dose for Lidocaine, it is given as according to the body weight. So 1 mg per kg body weight by slow IV injection, which is given 1 to 2 minutes and repeated after 10 to 20 minutes as a loading dose of 1 to 2 milligrams per kg body weight, which may be given followed by 0.1 to 0.2% infusion at 1 to 2 milligrams per minute for 12 to 48 hours. So the side effects of Lidocaine includes dizziness, drowsiness, confusion, respiratory depression, convulsions, hypotension, bradycardia, as well as hypersensitivity. So this drug is given with caution to patients with congestive cardiac failure and hepatic impairment. It is also given in low doses following cardiac surgery. It is contraindicated in heart block as well as porphyria. The other antiarrhythmic agent is Quinidine. Quinidine, this drug prolongs action potential duration and effective refractive period, therefore decreasing myocardial excitability and has anticholinergic properties. It comes as a tablet containing 250 mg of quinidine bisulfate. The indication for quinidine is it is indicated in ventricular arrhythmias and supraventricular tachycardia. The dose is 250 to 500 mg 3 to 4 times daily. The side effects include nausea, diarrhea, ventricular arrhythmias, thrombocytopenia, hemolytic anemia. Okay, so those are some of the side effects. So this drug should be given as a test dose for hypersensitivity. So as a test dose, you are giving it as a caution. So you are giving 200 mg as a test dose. Okay, and it is contraindicated in heart block.